Dr. Ahluwalia is here.
Yeah, well, because the big news obviously today, the Duchess of Wales, or Cambridge, expecting again. Reportedly, she has morning sickness, but it's like morning sickness on speed. It's like describing a hurricane
what is it called?
Hyperemesis gravidarum.
Yeah.
So hyperemesis.
Can I ask you, why do you make these things up? Why does the medical profession do this?
That way we look smart.
Yeah.
It's very easy.
But this isn't just morning sickness, though,
we all
right?
speak Latin.
Yeah.
Morning sickness is pretty common. More than 50% of women who get pregnant in the first trimester, first 3 months of pregnancy, will have nausea, vomiting. It's typically in the morning. That's why it's called morning sickness. When that becomes much worse than just a little bit of vomiting, that is called hyperemesis gravidarum. So hyperemesis is increased vomiting, gravidarum means pregnancy.
And this can be like 20 to 30 times a day, right?
So when you have nausea and vomiting, we ask you to, eat foods that are easy to digest, take oral rehydration, and rest. Those are when that doesn't work, you're throwing up so much that you can't keep anything down.
Even blood at some times.
Right. So then we have to get you into the hospital, put an IV in, and start to give you the hydration that you need. The concern is that the people who don't get the appropriate care start to have electrolyte imbalances and then malnutrition. And that is not just for you. The baby gets affected, right? And so that's why you have to be really careful.
She had this in the first pregnancy. Does it get progressively worse as you go?
Well, it's more common to have it in the second and third.
Does it get worse, though, in that second pregnancy?
Well, it's hard to know. It's already bad enough. I mean, between 20 times and 40 times, it's about, once you go to the hospital.
Didn't she go into the hospital?
Yes, she did.
She hasn't this time, has she?
Well, we don't know.
I heard that she had gone.
She had?
Rumor has it that she has.
Yeah.
But if it's as bad as it was the first time, I mean, this time they would be more careful to get her.
How frequent is this?
What is that?
For women having this?
How often does it happen?
It's 0.5 to 2%, which is really low. So it's 1% or less. But when it happens, it's pretty bad.
Is it a hereditary thing, something?
It's possible that it may be, but we don't even completely understand why it happens. We think it's some kind of hormonal imbalance that affects the gut, and that's how you start vomiting and start to have nausea.
Wow. So. Okay, next one, the Ebola. It seems like it's just getting worse and worse, the situation, as we're hearing. It's just being impossible to contain in certain areas.
Right. So, the problem is we don't have a treatment for it. And it's transmitted by blood products. That means this is one of those instances where the people who are taking care of the patients can also get infected very easily,
as we have seen.
So it's a crisis in Africa right now. There's 4 countries that are affected. But the concern is that if this virus is allowed to continue to be around in the human population, it may mutate and get to a point where it may spread to the U.S.
Back in the days when there were no airplanes,
right?
It was less of an issue, right?
It was less of an issue. Well, the problem now is that you can be from one continent to another in hours, and the latent period for this may be up to a week, so you may not know.
So you can be totally innocent and have no idea.
That's the problem.
Or maybe think you have the flu or something.
Right. And the concern more in Africa now is that there's so much misinformation that people aren't cooperating with the authorities.
And they're like cordoning them off and barricading them in, and that's causing craziness.
They're also doing native and home cures that don't cure, right?
Exactly.
There's no really strong health infrastructure to begin with. Sanitation is an issue. Right. All those things. But so that raises the question, would it not be as bad here because we have all those things?
I mean, yes, that is definitely the case. But the problem is, if these cases come in undetected, then you're sort of scrambling to quarantine everyone who's been affected, right?
Who they've come in contact with.
And since the death rate may be 50 to 90%, as soon as you get this, you may die.
But the 3 aid workers, doctors who've come back with this being treated, they're doing.
Is that first world care versus third world care? Is that why they're alive?
Well, we're using some experimental drugs on them.
Yeah.
So, we do have the resources, but, I mean, imagine if there were 1 million infected in the U.S.
Are you alarmed?
I'm not alarmed for the U.S. right now, but I am alarmed for Africa. I mean, this is
definitely.
Yeah.
Yes, I mean here.
I mean, this is an international crisis, essentially. We haven't paid attention to what's been going on there.
We all talk about things like the World Health Organization, not fully understanding what it is and what it can and cannot do.
Well, it's all about money, right? So the WHO and the CDC has criticized the first world countries to not pledging enough. I mean, I think we're trying to raise more money to send it over, and we're going to send some military assets as well to help them quarantine these people.
Dr. Ahluwalia, thank you.
Always nice.
As always, thank you very much.
Always great to see you.